How do you keep your patients safe from developing substance use disorder to prescription opioids and other medications? As a healthcare provider, it's vital that you monitor your patients for signs of potential misuse. But when should you start looking? The cascade from misuse to substance use disorder can be rapid, so monitoring should start as soon as medication is prescribed. What might the cascade to substance use disorder look like? Let's look at one example of the progression. First, a patient sustains an injury and is determined to be a poor candidate for many treatment modalities. The provider initiates opioid therapy. The patient is unable to work or continue the same social activities they're used to as a result of the injury or pain, and eventually is diagnosed with comorbid depression. The patient begins sporadically taking more medication than prescribed to help with anxiety and sleep. Next, the patient continues escalating their dose on their own. They seek additional opioids from friends and family or purchase them from illicit sources. The patient may begin experimenting with different routes of administration, such as crushing and snorting. Lastly, when the patient is unable to get enough opioids, they may begin taking additional substances together with the opioid, such as benzodiazepines or alcohol. Now, if we combine prescription drug monitoring with the initial prescription, we could identify the first signs of misuse and prevent the spiral to substance use disorder. At DRUGSCAN, we are toxicology and prescription drug monitoring experts. Toxicology testing is the most valuable tool available to you as a provider for determining what medications and other substances a patient is taking. With DRUGSCAN's toxicology testing, we gather information that can reveal whether a patient is engaging in medication misuse and is at risk for adverse events and substance use disorder. After retrieving a urine sample from the patient, it's sent to a lab where 98% of results are available in 24 to 48 hours. Color-coded online reports are then available to providers with information on the patient's current drug use. When providers use toxicology as a tool, early detection of misuse allows for early intervention that leads to better outcomes. With more than 35 years of testing experience, DRUGSCAN is dedicated to helping you make crucial decisions that affect the health and safety of your patients with increased confidence. Our CAP-accredited, SAMHSA-certified, and CLIA-licensed lab operates 24/7, with all testing performed in-house, getting you the results you need fast and efficiently, so you can focus on what matters most, your patients. To learn more, contact us at drugscan.com or call 1-800-235-4890.